First of all, good afternoon, and thank you to Valeria. She's not here right now, but Alessandro too, for the invitation. And I just have to let you know that I prepare my presentation in Italian, so I could do a simultaneously translation or just do it in English, okay? I will try my best. So I'm Yutzil from the GIREX clinic. I represent the clinic abroad. It's a fertility clinic, as you can see, in Spain, in Barcelona and Girona, okay? I will try to make a portrait, a really one, from the patients from Italy or coming from foreign countries, okay, to Spain, how they really feel and how they really are when they arrive to the clinic, okay? Most of the time, I'm also with the patients during the following of each treatment. And I'm going to explain you step by step. Okay. The Italian patient, yeah. See, no, I have it, thank you. What are they looking for in Spain? Okay, of course, one of the motivations are the PMA, sarebbe assisted reproduction treatments, okay? Could be because they are homosexual, heterosexual, or single ladies, yeah? They are looking for state-of-the-art techniques that allow to go specifically or deeper in a genetic problem, following the diagnosis they receive from the doctor here. And they're looking for not limits, looking for who allows to have another option and doesn't lose hope or the time during treatments that cannot have success at the end, okay? What are they waiting for? Well, first of all, they need to clarify all the doubts because they have a mess in the head when they arrive to Spain, okay? They are really lost and they don't know absolutely all the procedures and all the opportunities they have in Spain. Normally, because there is a need of real information from their doctors, okay? So one of the doctors, the normal or the able ones that they always visit during their life, for example, the same gynecologist, cannot help them till the end of this process. So just give an advice and send them to Spain, but cannot specify about the procedures, okay? Could be because of religion, because cultural reasons, or many other ones, yeah? So this patient tried to get back the trust. Actually, they look for trust again in another kind of doctor that could help them and don't lose this hope, okay? Well, when they found a motivation to go to Spain, I have it in Italian, sorry. Well, first of all, the first need, it's the information, okay? They don't have enough information and enough support from their doctor. So they try to look in a big swimming pool for a solution. There is, that take a lot of time to make a decision and to say, okay, I'm ready to go abroad and to do the treatment in another country that's not mine, but fortunately they speak my language, okay? There are limitations, limits actually, and about the gamete donations here in Italy that everyone knows. It's really difficult to access to oocytes donation, egg donation, sperm donation, or embryo donation because the law. And even if the Legge 40, the 40 law already changed 3 years ago, there are still limits to access to these techniques. There are no own banks, so that complicates the situation. La legge di bioetica restrittiva, it's the bioethic law. It's so restrictive in this kind of treatment. So this is one of the first motivations to go abroad. Other ones are to have an infertility diagnosis to the couple, a low reserve, a low ovarian reserve that we don't know till we go abroad, or our doctor doesn't specific from the beginning, or genetic problems already certified and by a biologist, of course, or genetician here, or one of the partner has an infertility already confirmed. Okay. Okay. About the state-of-the-art techniques in Spain, there are not limits to access to egg donation or sperm donation or embryo donation. It's most accessible. Sorry. There are no waiting lists, and there is the possibility to do a treatment for all the ladies. What it means, if I'm a single lady, for example, one of the single lady over there, yeah, and it's not ready to get pregnant right now, but she's planning for the future. She could preserve her fertility, okay, and try to make the decision later. Or she's a single lady and she want to have a baby right now, but she has no partner. There is no limit to access to this kind of treatment. You can do an artificial insemination or IVF with sperm bank without restrictions. Here, for example, it's difficult to access because of religion. Yeah. Other situations are, for example, homosexual couples that cannot access to a bank sperm. In Spain, of course, it's possible. Sorry. It's also possible to cryopreserve the embryos and gametes for a long time, till the lady has 50 years old, okay? The other possibility is to not wait. For example, the second option, not waiting list. Here in Italy, to begin a process, assisted reproduction treatment, could take from 2 months till 3 years, okay? A waiting list. I'm talking about the beginning, the first diagnosis, till you complete the treatment. In Spain, no. You can just visit the doctor, receive a diagnostic, and after that, begin the process, and will take around 2 months, maximum 3. That's what we are. Founded in 2007 by Andrew Rocas, the doctor. It's not here today. Our team is international and, of course, able to speak the same language of the patient we're receiving. Assisted reproduction treatment is our specialty. We are trying to look actually about our priority. It's trying to treat the patient the most human the most human, actually show the most human side we have. Because if you treat the patient like a number, it's not the same, no? it's difficult already to make a decision to go abroad to do this kind of treatment and to accept you have an infertility problem. It's already difficult. If you don't have a support, a real human support back, this is the worst thing that can happen, actually. Because you can go wherever you want, Croatia, Turkey, Russia, Spain, whatever. But if you be treated like a number, will be not the same. And even if you try and try and try, the process psychologically, the psychological part of this process is really hard for them. You have to be on their side to perceive this sensation, yeah? These feelings. Well, we create many studies just to be near to these patients, yeah? We discover all the needs they have during these studies, okay? Trying to be different, of course, receiving them and treating them, and personalizing every situation or clinical history. Other thing we try to do is to integrate the alternative medicine. Yeah, we have many different contexts that participate, specialists that participate in our, I'm going to explain you now, family days. It's named family days, okay? This is about, I already talked about it, to accompany the people in a different way, not only the human way. Let me just one sec. Okay. GIREX already developed this journeys, family journeys, trying to make the possibility to the foreign people in the same country they live to exchange with different specialists. Could be nutritionists, psychologists, biologists, geneticists, or different associations that could help them. For example, exchanging the cases they already live during a treatment or having a sorry, I have many languages in my mind. Okay, to help the people already have a baby or who are looking for a treatment, or this one who are during the process right now. So they can ask all the doubts they have exchanging in this kind of journeys. These are the rates that already changed the last year with the people who assist to these journeys, and after they clarify all the doubts and they take the decision, of course, gonna be higher step by step, following the different treatments we have. For example, the last year, I didn't express myself in a good way. I'm gonna try again. The last year, the artificial insemination, it's 43% higher than the rest of the years because of homosexual couples, for example. IVF, it's 106% more required or demanded for the patients, yeah? And also gamete donation, of course. To this journey, 850 patients participate the last year from different countries. 368 babies were born, and more than 400 people during these journeys we create to exchange with them. And that's all. Thank you very much.